Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. wildhealth.com for all the information on becoming a patient or working with us.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.
Seed oils, and I'm using that term broadly just so that we have something to use as like a catch-all, but whether that's safflower oil, sunflower oil, vegetable oil, canola oil, we're kind of using all of those under the umbrella of seed oils, even though not all of those are seeds. So I guess let's start off first with, like, why are these so prevalent in modern diets?
Yeah, I think they're a lot more prevalent for a couple of reasons. I think the first thing is that they're using a lot of foods to make them more shelf stable. But also, like, when we took out trans fats, we were forced to then find alternative fats and oils for a lot of our processed foods. And so I think that they're using a lot of like combination products. They're using a lot of like blends of different seed oils just to make them more inexpensive.
Yeah, and that's been my that was sort of my understanding and take home too, was the reason we have so much of this in our food is because they're cheap.
Yeah.
And you look at what crops are grown, and what crops are grown relatively inexpensively, and it's like soy. So there's a lot of soybean oil, vegetable oil. That stuff can be grown pretty easily, as opposed to things like olives and avocados, which are more expensive to grow. So your profit margins are going to be lower on the omega, the lower omega-6, higher omega-3 oil products. So health risks associated with excessive consumption of seed oil. I think the concern is that our body converts alpha linolenic acid and omega-6 fatty acid that we get from food, or linoleic acid that we get from food, largely from vegetable oils like corn and soybean oils, into arachidonic acid. And arachidonic acid just sounds like it would be inflammatory, and it is. It sounds like a spider acid, arachnoid, but arachidonic acid, and it does give rise to arachidonic acid gives rise to a bunch of inflammatory compounds. But how big of a problem is this really? What is excessive consumption of vegetable oils, corn oil, soybean oil, etc.?
Yeah, I think for everyone, this is going to look a little bit different. But I think that in terms of like excessive consumption, I think it's looking at how many food products are you opening up a package and eating. So if you're eating a lot of things that are shelf stable, if you're eating a lot of things that are intended to kind of sit in your refrigerator, your freezer for a long period of time, chances are they're more likely going to contain some of those vegetable oils, seed oils. Things are going to be a little bit more inflammatory. Versus if you're getting whole food sources that may have, some of these omega-6 fats, which everyone kind of demonizes, which we find that in the context of a more balanced diet, plenty of both omega-3s and omega-6s, and lots of fibers and whole food sources that contain polyphenols and a lot of other protective compounds. I think that that's going to be more health promoting versus, the first scenario.
Yeah, that makes a ton of sense. We'll link to there's a great study in the British Medical Journal, the open heart subcategory of the British Medical Journal, that looks at evidence implicating omega-6 rich vegetable oils as a causative factor in atherosclerosis and coronary heart disease. And there's lots of reasons why you would think this is the case. So like greater amounts of linoleic acid oxidation products are found in LDL and plasma of patients with atherosclerosis. A diet higher in oleic acid or lower in linoleic acid decreases LDL susceptibility to oxidation. Linoleic acid is the most abundant fatty acid in LDL, and is vulnerable to oxidation. So there's lots of like pathophysiologic reasons why this might be the case. And then there's opposing views around linoleic acid. So it can reduce the total cholesterol and LDL. And when you look at like all of the clinical studies around this, I'm really left kind of scratching my head. And it seems to me that, yes, linoleic acid gets made into arachidonic acid, but only like 1% of what you take in is made into of the linoleic is made into arachidonic acid. And it's really more about that omega-3, omega-6 balance. So you probably could eat a fair amount of linoleic acid as long as you were balancing it with a diet that was really highly rich in omega-3s. I think to your last point, that's not what most people eating lots of omega-6s are doing, though, right? It's not like they're mixing the pre-made pancake mix with the the safflower oil in it, or sunflower lecithin, and then they're like having a great meal of like wild caught fish for lunch. That doesn't tend to be the way that people eat. I guess if you were going to give people actionable information about seed oils, vegetable oils, soybean oils, like what's your sort of your take home message for a patient today? So I come to you, I'm new to Wild Health. I read my health report. It says I should probably be focusing on things like avocado oil and olive oil, but it also says a million other things that I should be focusing on. Where does this kind of play into your priority list when you're counseling patients on nutrition?
Yeah, that's a great question. That comes up all the time. And I think it's really important to like, just first and foremost, like make sure that we're educating them, because not everybody knows what to believe now. It's so overwhelming. We're inundated with all of these different philosophies and kind of all or nothing mentality. But I think it's a lot more than that. And I think awareness of what they're eating and what foods might have these potentially harmful vegetable and seed oils is really the first step. So I have lots of different educational tools, and we have a conversation about, what to look for in their pantry. But I think just the most simplistic thing that I can say is like, keep avocado oil, olive oil on hand in the house. Try not to cook with a lot of other things. Eat a 80-90% whole food diet. And when you're out to eat, that's probably where you're going to be exposed to the most vegetable oils. So out to eat, or of course, like if you're eating a lot of processed foods. But at home, I use olive oil or avocado oil mostly for cooking. So it's a little bit more stable at higher temperatures. So if I'm roasting or sauteing something, I'm going to use something like avocado oil primarily. Whereas if I'm making a homemade salad dressing or just kind of like using a little bit of olive oil as a drizzle, or even making pesto, I'll use olive oil for that because it's not quite as great at high temperatures. So those are my two go-tos. And then of course, I don't want people to freak out that they can't ever go out to eat again, but just being mindful about what kind of restaurants are you going to and what are you choosing? Are you choosing the deep fried options? Are you picking with the salmon, with the side of vegetables that may or may not have been sauteed in something like canola oil?
Yeah, I think that is like such practical and actionable advice, right? Cook at home most of the time, which is what we generally tell patients to do. Number one, you just have so much more control over what you're eating. And number two, it's less expensive. And number three, you're able to, tweak it exactly the way you want it and just have things like avocado oil and olive oil at home. I will say that it took a little getting used to if you have kids and maybe you're making like pancakes or something at home and you get some, really simple largely whole food, like buckwheat flour that you want to make pancakes out of. If you're making it with avocado oil, well, if you make it with olive oil, your kids are going to taste it.
Yeah.
If you make it with avocado oil, you can get away with it. It takes a little bit of getting used to, but definitely some home experimenting in the kitchen, and you'll find out which oils are of the two are more palatable for which indications. If you ever want to see why you should be cooking with avocado instead of olive oil, just put a little bit in 2 pans and put them both on the stove and watch the olive oil one start smoking a lot earlier than the avocado oil one does. And then, I mean, it's, if you're eating mostly at home with avocado and olive oil, and you go out to a restaurant and you get a piece of salmon with some sauteed vegetables that were probably cooked in vegetable oil or canola oil, that's one sacrifice, as opposed to, fish and chips that were just, and there's plenty of reasons why the former is healthier, and it's not just because of the oil. So I think I think it's what I'm taking away from chatting with you about this is the places that vegetable oil, canola oil, soybean oil, safflower oil tend to show up in our lives tend to be in the context of either unhealthy, non-whole foods that you're getting something deep fried, or really processed foods. And there's plenty of other reasons, which we've talked about before, about why we're going to try and avoid processed foods or deep fried foods. And it may not just be the oil itself, but they're sort of they're like a passenger in an unhealthy car, even if they're not the driver. So I think that's really good context and gives people a sense of what to do here. If I'm out and I'm eating and somebody brings me a salad, and I ask for the dressing on the side, do I need to ask them to bring me olive oil, or can I just enjoy the dressing that somebody's giving me at a restaurant?
So that's definitely a personal decision. I've done both over the course of my life. If you like olive oil and vinegar, great. If you're like, this is the worst salad ever, this is not even worth eating the salad, then go for the regular dressing and just use high quality oils at home. You're probably going to be just fine.
That was the permission I wanted. I appreciate you letting me have that. Awesome. Well, Ari, thank you so much. This has been great. And, it's what I used to think was a pretty simple topic. I did the dive in the literature. I'll link some studies in the show notes, and now I'm completely confused about it, except I think you've helped me clarify it a little bit. If I can give you the take home, and you tell me from your perspective if I've got this right. In an ideal world, I'm probably eating olive oil and avocado oil as my oils, and I'm avoiding seed and soybean and corn oil. But if I slip up and it's 10 to 20% of the oil consumption I'm having is omega-6 rich oils, probably not a long-term health benefit, health concern, especially if I'm eating a diet that's high in omega-3s. Yeah,
I would totally agree with that statement. And I think as more and more comes out, I think we always are learning. And so I think 80-90% whole foods, enjoy yourself when you go out. Don't worry so much about a little bit of vegetable oil if you're eating plenty of plant foods. Long story short.
I love it. Thank you so much. Really appreciate you.
Sure. Thanks.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.